Hello, everyone, and welcome to the next audio podcast in this series, the LabTronix series. Once again, this is a collaborative between the RPSG and KDARS. It's another Storm Robotics production, and this is an overview in electronic patient records, or EPRs. And once again, this is part of the Ballistix Edition. Today, as part of the sort of introduction, I'm going to provide an overview in context of the role of information communication and technology, or ICT. And so ICT plays sort of a major role, or has been playing a major role in improving the access and the efficiency and the quality aligned to the effectiveness of most processes that are linked into aspects of healthcare. The concept of in line with ICT in line with ICT, there is the concept of e-health as part of an application aligned to healthcare, wherein e-health in main aspects of healthcare, ICT along with e-health is generally commonplace. ICT also allows a link with new applications and rejuvenating or reinventing some of the classical aspects that surround our healthcare practices, and cooperation amongst different practitioners in this way aligned to aspects of e-health or electronic patient records allows cooperation, or can prompt cooperation between different practices and practitioners to become more enhanced. And in line with this, treatment modalities and methods can also be improved. Generally, all health professionals can manage activity and day-to-day practices in and around aspects of healthcare more effectively, and the quality of aspects that are aligned to between health sectors, including hospitals and medical services, can also be better. There is works that have been published by an author, and the citation around that is at the bottom of this slide. In line with this as well, health professionals in around different aspects of health practices can effectively work more collaboratively, coordinating different activities and sharing knowledge in context of multidisciplinary team with and without patients, depending on the scenario. And health systems can enable, at least through electronic patient records, can enable patients to have a more of a control around a sense of well-being, at least in some context, and by accessing personalized and qualified health information and accessing appropriate medical care as well. Treatment methods again can allow a better once again can allow a sense of effectiveness and efficiency in line with information communication and technology, and also where, for example, in some aspects of medical practices, and depending on for example, depending on particular particular and specific areas of medical practices. For example, there can be more of a sort of a streamline between different ways that patients and professionals are using and implementing aspects of healthcare, health service through the use of electronic patient records as well. In context of e-nephrology or e-health in nephrology care, e-health is generally a service or a health service and information delivered through broadly speaking through the internet or internet services, but also through organizations wherein there is information and access to aspects of healthcare that are aligned to sort of aspects of service, healthcare service provision, and also in relating to certain technologies in some way, at least wherein, for example, patients and health professionals searching out for information relating to specific areas of healthcare are initially through, for example, the internet, but then perhaps through technologies thereafter. E-health in this context has potential to extend nephrology care or kidney care beyond traditional practices that have known to be part of sort of routine in aspects of healthcare. Now, in line with this, also public health emergency has caused by, for example, COVID-19 and the pandemic, has brought a new sense of urgency to the sort of to aspects of integration integration of e-health into patient care, and wherein there had been a requirement to limit, for example, direct face-to-face contact at for example, healthcare facilities, etc. In line with this, also, e-health is potentially used to transform sort of kidney care practices, especially around screening, sort of point of care, and also the management aspects, at least from a sort of a laboratory medicine perspective, but also wherein from a clinical perspective, specialists as well as other healthcare practitioners are having to for example, implement electronic patient records alongside with routine practices to ensure patients get the best out of the care during the pandemic, but also in times where for example patients and professionals having to work through electronic patient records to ensure that patients get the most out of healthcare through in and out of for example, in and out of frontline practices, healthcare practices. So health information technology, there wasn't a health information technology group that had been established to facilitate the identification and management of patients with chronic kidney disease using EPRs or electronic patient records, and from that there is a works by Wang and Ku in 2020 who have highlighted some aspects around the health information technology working group alongside the use of e-health in different specialisms. Electronic patient records, but also what is referred to as electronic health records, generally are by way of where patients and professionals can access different aspects of health, different aspects of patient care in relating to how aspects of, for example, a patient's care has been documented for example, through electronic patient records versus traditionally where aspects of particular areas of healthcare or practice are linked, have been traditionally documented on paper, for example. So digital versions of patient medical records or electronic patient records can contain, for example, demographic information, diagnoses, biometric and vital sign measurements, treatment plans or healthcare plans, particularly in and around multidisciplinary team, but also in and around different area of specialisms. If patients have for example, historically are diagnosed, for example, for one particular area of health, but however, wherein patients may have to see other health professionals in and around other aspects of healthcare. So generally, there, apart from sort of treatment or care plans, there's also sort of medication information, laboratory investigations, and for example, X-ray or radiology results in and around different areas of healthcare as well. EPRs can be accessed by patients and service providers through sort of online modalities with functions to support care-related activities. EPRs are used to provide alerts, or can be used to provide alerts and decision aids for management of acute kidney injury, for example, in context of nephrology practice and chronic kidney disease, and allows documentation in context of screening for chronic kidney disease, but also help in the identification of potential candidates for research and clinical trials, wherein, for example, particular drug trials or a form of practice, for example, may be advantageous in patients in some patients versus others. So electronic patient records can help in that regard as well. And there's in and around this, there's also self-management by tracking and presenting data and providing sort of individualized recommendations, or wherein different health professionals from a collaborative point of view can be involved in providing sort of recommendations in context of patient care as well. Now, in line with electronic patient records, as we know, for a little while now, there have been sort of modalities where people can connect through, for example, something that is referred to as telehealth. So telehealth generally consists, or can broadly consist, where, for example, there can be, for example, Skype, Zoom, or MS Teams, for example, as sort of ways wherein generally people can use those modalities to communicate, etc. But at the same time, in context of service provision, telehealth can be linked with those sort of facilities where health professionals can be involved or are involved to provide aspects of health service as well. Now, the use of digital services or devices and applications such as, for example, video conferencing, and also including, for example, digital stethoscopes in line to clinical practice, can allow the interactions between service providers and patients to bridge geographic barriers as well. And telehealth also allows remote visits for patients with particular conditions, and multidisciplinary care visits for patients with multiple service providers can be advantageous. Again, now video consultations with allied health professionals and service providers can be helpful. And again, telehealth for urgent visits for providers or service from service providers for patients pre and post, for example, pre and post particular conditions. For example, with recipients with particular health concerns or issues, can be advantageous. Now, mobile e-health, a little bit like telehealth in some way, can also be helpful. The use of mobile devices such as personal or digital assistants, mobile phones, tablets and smartphones can be used to provide and improve aspects of service provision in context of clinical care. Methods of care can include, for example, text messaging and aspects of different mobile apps as well. Now, mobile apps are useful in context historically or traditionally, at least where app technology is concerned. App technology that is linked to, for example, polypharmacy, where patients patients may be on one or two or three or several medications to aligned to their health condition, whatever their health condition might be, could actually could be useful. And there is some again works by Wang and Ku in 2020 that highlight some of this in context of e-health as well, and educational apps for patients and professionals in context of pre and post particular health conditions can also be useful. However, the literature around sort of educational apps is actually at the moment is limited. There is whilst there has been a lot of literature and public works around sort of app technology, etc., there is limited literature out there in context of actual educational apps in context of supporting service provision for service users. Now, also at the same time, smartphone sort of cameras to read, for example, urine dipstick test or test strips for urinary tract infection or proteinuria have proved to be quite helpful or useful in some ways. Blood pressure monitoring and transmission of data to healthcare providers has some advantages. Mobile app for nutritional aspects are also quite useful, and electronic pill boxes for medication adherence monitoring and reminders through mobile apps, for example, can be quite useful, and fluid overload monitoring through bioimpedance sensors as well can be quite useful. In context with sort of with the above, website healthcare is still quite a bit of a grey area. Whilst there's a growing body of sort of the way the way information and healthcare information in particular is accessed online. So website healthcare is another aspect that has been documented in some contexts, at least where health literacy aspects are concerned. But a program delivered through a website browser to internet connected devices or websites websites in context of computers or desktops as well as smartphones can be advantageous. Educational modules for patients, and particular where for example particular conditions such as chronic kidney diseases can be important in and around the educational aspects. Now, social media as well. In this, aligned to this, website and mobile applications can be useful, and they can serve as platforms for sharing understanding and lived experiences. And in context of social media, this means basically where there's where patients and health professionals through social media, at least to some extent, can and do use and where it's been documented at least that do share, for example, clinical and non-clinical based information. Discussion platforms for patients on discussion platforms also have allowed patients and professionals to access to share perspectives surrounding different forms of renal replacement therapy in context at least where nephrology practices are concerned. And also social media generally can and has been used within the nephrology specialty to promote aspects of CKD awareness. I'm now going to talk a little bit about some of the challenges of adopting sort of e-health. And so e-health can enhance sort of aspects around disease detection and monitoring. It can introduce new safety concerns owing to or linked to the design around e-health and sort of the technological failure and some aspects that help document technological failures or invalid data as well. Patients with particular diseases such as chronic kidney disease can have complex requirements or needs that can make remote monitoring through e-health tools less suitable than traditional face-to-face care. And certain aspects of sort of what is known as what would be retrospectively known as for example the physical exam, where patients and professionals in a face-to-face environment, for example, would traditionally be used as a way to assess patient care in context of general physical in context of physical examination, but also such as examination of for example where some patients, for example, may have particular forms of chronic kidney disease where it can be linked to scarring around, for example, the urinary tract, and wherein there can be historically issues around where if there had been sort of obstructions and restrictions around the urinary tract, then through online versus through online versus a physical examination around, for example, catheter sites, where patients with forms of particular chronic kidney disease, for example, through the urinary tract, may need to would have to self-dilate, for example. In this context, the sites in relating to self-dilation from a remote perspective, and assessing from a remote perspective for nephrologists or nurse practitioners, for example, would be and can be challenging, and so may be difficult to perform, again, through video consultations. So providing CKD education through sort of educational modules, for example, alongside mobile apps or text messaging, may not, for example, fully address the complexity of patients' sort of requirements. Patient requirements in aligned to particular ways into ensuring that they are getting the sort of the frontline practice care that, for example, they may require through online ways versus versus physically. However, again, educational websites or online, for example, can be useful if they are, for example, are linked in some way through clinical practices. And once again, I would like to make some general acknowledgements as we come toward the end of this sort of slide set. I want to acknowledge colleagues and collaborators, or Czechowska, based at an academic institution, Coventry in the United Kingdom, and also where or Czechowska has been involved in the renal patient support group, the RPSG, and Christine H, who has been involved in the renal patient support group, the RPSG, and also where Christine H has also been involved with the kidney disease and renal support group, or KDARS for kids, as well.